the bad news, right? Okay, so your role player is supposed to be Dr. Rifat. We will read it. If she will arrive, it's okay. Otherwise, I will be the role player. Okay, so the role is neonatal registrar, working in a busy tertiary level unit. Setting is site room in the neonatal unit. You are talking to Mrs. Smith, mother of Lily. Background information: Lily was born at 24 weeks gestation, weighing 620 grams. She is now 4 weeks old and remains ventilator dependent. Clinical assessment and subsequent echo scan showed a large PDA patent duct. Lily received a 6-day course of indomethacin. A repeat echo scan has shown the medical therapy to be ineffective. She still has a large duct. Your consultant has decided that Lily will need transfer to the regional cardiac unit, where she will undergo duct ligation. Without surgical ligation, Lily will not be successfully weaned from the ventilator. So the task is, please explain the procedure of PDA ligation to Mrs. Smith with a view to obtaining her consent to the procedure. Mrs. Smith will have an opportunity to speak to the operating surgeons. However, consent should be obtained in case Mrs. Smith is unable to accompany Lily. So this is the scenario, and you have 6 minutes and 9 minutes. Anyone wants to be the role player?
Hello.
Assalamu alaikum, Irfan bhai.
Ji walaikum salam.
Would you like to be role player?
This is scenario for what? Hope for me or somebody else?
No, Dr. Sandeep is the
This was
candidate.
okay. No problem. I can be a role player for this question.
Okay. So do you need some time? Have you read it, the scenario?
No problem. No issue for this scenario.
Okay. Okay. So Sandeep, you start. I will start the time. You have 6
Give me a
minutes.
minute. Just a second.
Okay, no problem. No problem. Take your time.
Dr. Bakar, this was for me. Okay.
Yes, you start.
Yeah, your screen showing you disabled?
Yes.
Okay, no problem.
I work at the whiteboard. Na? Maybe you will print something.
I cannot draw actually here.
Okay.
How to draw in this whiteboard? I don't know.
Are you using mobile phone or any?
Okay. Hello, good morning.
Good morning.
I'm Dr. Sandeep, one of the doctors managing your child. I guess, I believe I'm talking to mother of Lily, Mrs. Smith.
Yes.
Mrs. Smith, I can understand this is a very stressful time for you. But I'm here to discuss regarding some of the plans that we have for the Lily. Is this right time to talk to you?
Okay, doctor.
Okay, Mrs. Smith, actually, we have planned a surgery for Lily, and I'm here to explain that procedure to you. And after that,
why, doctor? Why
yes,
surgery, doctor? Because
Mrs.
she's
Mrs.
so
Smith.
small, tiny
Mrs.
baby,
Smith.
and it's very shocking for me.
Yeah,
All
Mrs.
of a sudden you're telling me it's.
Yeah, Mrs. Smith, I can understand your worries. I will explain to you everything. Before that, before I start with the explanation, do you want someone to be with this in this meeting?
No, doctor.
So can you please tell me what I have been told to you up till now?
Well, I was told that this Lily has been having some duct is open, and
Yes.
that's making his making him difficulties for his, you people are not able to wean him down from the ventilator. So, and you people try some medicine, I believe, and it is not effective. So that was I was told.
Yes, Mrs. Smith, I appreciate your knowledge. Actually, Mrs. Smith, as you have been explained already, that there is some duct open in Lily's heart, that the ducts connects between the two large blood tubes. And because of this blood tube, a lot of blood goes to the lungs and make the lungs wet and stiff. So because of that, Lily is not, we are not able to wean Lily from the ventilator. Uh, am I clear so far, Mrs. Smith?
Doctor, maybe some other problem, maybe not this problem, something else can be possible.
Mrs. Smith, I understand your worries. However, this duct is responsible for the current situation of the Lily, and we have confirmed with the jelly scan of the heart, and that's why Lily is not able to be weaned from the ventilator. And we have tried to close it with medicine called indomethacin, and we had a meeting regarding this before. However, this duct still remained open after giving the 6 days course of indomethacin. That is the maximum which we can give. So now the option remains in the surgery. I'm sorry to tell you that surgery is the only option remain now, Mrs. Smith.
So, doctor, this if we don't close this duct by surgery and give some
Mhm.
time, is it possible?
Mrs. Smith, this is a very good question, but this duct usually it does not get closed at the time of birth, and after giving the medication indomethacin, it is very unlikely that the duct will get closed on its own. So we have to intervene, and if we don't intervene, the problem will continue, and it will be very difficult to remove the breathing machine from Lily. And do you know, like I would like to tell you that if we continue, if the duct continue to remain open, the lungs will get damaged more and more. Then that will be difficult for Lily, Mrs.
Oh,
Smith.
doctor. Oh, oh, doctor. But I heard that this thing is very common in the early born babies. This duct close with some layer, but I'm surprised what happened to my child. Why it is not closing?
Mrs. Smith, this is a very good question, and your concerns, your knowledge is quite right. Usually, this duct is normal when the baby is in the womb. However, because the baby's lungs are not functioning, so it does not require much amount of blood. When the baby comes out, the lungs expand with the first breath, and some chemical changes occur in the body, and because of that, this duct get closed and more blood flows to the lung. However, in
Okay.
preterm babies, because of some unknown reasons, this chemical changes does not happen, and this duct remains open. Actually, exact reason that is not understood why the only preterm babies have more chances. But the chemical changes which are responsible for closure of the duct does not happen in the preterm babies. That's why it remains open there. Are you following
Okay,
me,
doctor.
Mrs.?
Doctor, what is the procedure? Yeah, thank you, doctor. What you will do for the closure of this duct? I mean, it is safe for my baby. Is my baby any danger?
Mrs. Smith, your worries are quite right. But Mrs. Smith, this procedure is very much necessary, and this is a major procedure actually. This is done by a surgeon, a heart surgeon, especially who the one who operates the babies. And this is done under like baby will be put to complete sleep by a specialist called as anesthetic. He will give some medication.
6 minutes.
He will give
6 minutes.
yeah, he will give some medication to put the baby to sleep, and this procedure will be carried out by the surgeon in uh, operation theater, and it will take around 1 hour. In this procedure, and incision is made below the left arm, and through that
Yeah.
incision, through that cut, the surgery is performed. How, is
Okay,
this clear?
doctor. Yeah, doctor, to some extent. But would you like to do some tests before the surgery?
Mrs. Smith, we have done the necessary test, jelly scan, and necessary test required to make sure that the child has this PDA problem, ductus problem. So right now, as of now, we have done everything which is possible in our hands, Mrs. Smith. So we need to have your consent for the procedure, Mrs. Smith. I would like to.
Okay. Doctor, just give me some time. I have a discussion with partner. I
Sure.
will explain to
Yeah.
him
Yeah.
regarding what are you have, what are your plans.
Yeah.
So after that, I will be able to decide and give you consent.
Yeah, Mrs. Smith, you have all the right to discuss with your partner with this all the information, and we would like to hear from you as early as possible, as this procedure is very much important. However, before that, I would like to explain that this procedure, like every other procedure, has some
Yeah,
side effects.
yeah.
Like there can be side effects because of the sleeping medication. However, the sleeping medication science has advanced so much that this chance is very less. Like any other procedure, there can be some bleeding, but the expert surgical team will take care as minimal bleeding as possible. And sometimes there can be some changes after the operation. There can be some infection, but baby will be receiving antibiotic treatment for that, Mrs. Smith. So the success of this procedure
Uh,
is very much high, and the drawbacks are minimum. If we weigh benefit against risk, the benefits are more, Mrs. Smith.
there's any chance this procedure may fail?
Mrs. Smith, I would like to tell you that this procedure is very much successful, and there is no chance that the procedure, there will be a recurrence of this ductus after doing this operation, because it is completely ligated under vision. So the chances of failure is very less. So, Mrs. Smith, if you want, we can have another meeting with your partner, and we can address your concerns with him. Also, I would like to tell
Time
you
is
that.
up. Time is up.
Yeah.
Yes, Dr. Irfan, your feedback, please.
Yeah, Sandeep, so that you introduce yourself and you also make sure get who's to whom you are talking. And agenda was a little bit late, number one. And number two, prior knowledge you ask after a long time. And actually, background voices are too much. I will request you if you can make it minimized. And secondly, you are looks like you are in rush. And you are
Right,
hurrying
right.
to
Correct.
explain everything. Okay, number one. Number two, at the end, you made sure that the things were clear to the mother. Initially, you didn't make sure that what you are giving information is clear to the mother or not. You remember at the end, last conversations, right?
Right, right.
And you explained everything nicely. But the thing is that it takes time for the communication to be on the track. And otherwise, I think you did good. But the only thing which I told you, it looks like you are in rush, okay? And it
Actually,
was a
what
long
happened?
conversation.
Yeah.
Yeah. And secondly, your conversation was more than 30, 40 seconds. If you just
Yeah.
see, and you just give
Right.
information, give some pause, and
Right.
just ask mother what I told you. I'm clear to you so far. Is anything confusing you? So
Right.
that it will be more beautiful and sophisticated communication, and it makes some sense. But I say it was 70%. It was good, but it takes time
Right.
to
Right.
be on the track.
Right. Right.
Yeah.
Correct.
And then after that, we try to give sum up. At the end, we discussed that he has the PDA, which is filled for the with the conservative measures. So we decided for the. If we just initially you started directly then you understand, oh, I didn't ask prior knowledge, right? It happened to you. So then
Okay,
you
and
start asking me this thing. And at the end, if you get some of this is what the any surgical flow here, and he will be shifted to the other. This thing was missing. We will shift the patient to the other hospital, the tertiary care for the cardiac heart issues. So otherwise, I believe it will get better with the time.
yes,
Anybody else
thank
can
you,
give
Dr.
the,
Irfan. So,
yeah.
anyone else has the comment? Okay, so regarding me, Dr. Sandeep, your knowledge was very good, and you explained almost everything of the query, of the questions, of the role player. But the something regarding the communication, you have to be a little bit like receptive, like you have to be a good listener. Is
Yes.
Dr. Irfan says that you were in a little bit hurry, and like for example, you break the news for the surgery, right? So after that, you keep quiet. This quiet is maybe you feel it is for you it is long time, but for the role player, this quiet is very little. You can let them to explain their feelings. So at that time, you have to be quiet for some time till their role player stops.
Yes.
And I feel that it was overlapping of the role player and your communication. So this is the reason because you were anxious or you were anxious to tell their
everything.
one question and you were telling hurriedly. So this is my concern. And you use some jargons. Have you explained about ventilator or you no? It's a breathing machine.
A breathing machine.
You explained it before.
No, actually, he is already in breathing machine. No? She must have been known like.
No, Gemini will not ask that. It must we already they know everything, but we have to explain. They want to know from our mouth.
I told that the child
Nothing
is
in
already on
nursery.
breathing machine,
I
and
feel
we are not.
good. Nursery. Okay.
If you explain breathing machine is the ventilator, the next time you can use the ventilator. I couldn't. Okay.
Okay. I
Yeah,
throughout
yeah,
I
no
use
issues.
breathing machine actually.
Good luck, inshallah.
Okay. So the other thing is, you said about surgical. There is no chance to reoccur, right? I don't
Yes.
think so. There is no chance.
Actually, in leaflet they have mentioned like this, like the chance of recurrence is not there.
Not almost 100% not there.
Yes.
It's right.
I don't know.
They have not mentioned
Right, right.
100%, but they have said that there is
But
no
it is
chance of
very, very,
recurrence.
because it is,
Maybe
see, he
I'm not
don't,
sure actually.
I
no,
will share the leaflet in
if,
the group.
no, you're right,
Dr.
right.
Irfan, please mute. Okay. So I don't know about it either.
I'll share the leaflet in the
Maybe.
group.
Okay. So that we understand this. Okay. So anyone else has the question? Any comments regarding this scenario?
Good, actually.
For,
Scenario was nicely done. Only few things like which already mentioned by Dr. Irfan as well as Dr. Vakar, both of them give very like correct comment. It was appearing like you wanted to complete, you wanted to give the full details within a span of time. That rushing impression was coming out. But at the same time, within short span, you touch all the required objectives of this scenario, which is like procedural steps, complication, as well as like why needed and why there is urgency of this procedure to be done. So that's excellent. I would rather say within short time you cover all the points. So that's a good point. And one time you use this ventilator, second time you used breathing machine. So that is okay. And agenda, I think Dr. Irfan, he brought to you back to the agenda, like it
right.
to go to the wrong track, but then he brought to you back to, and again you came back on the track and mentioned the agenda. Otherwise, was good.
Okay, thank you.
Yeah, shared the leaflets of this. In that you can see. You want later, you can read. No problem.
No problem. You can. Yeah.
No, it's
You
okay.
can send on the group. We'll see later on.
No, that is usually
So,
this is 100% lawyer.
Mhm.
Most are 90%, and it is not a failure.
So I have
It's because
In this
yes.
leaflet, they have said, like, will PDA come back? They have mentioned, no. Once your baby has recovered from this or her problem of prematurity, PDA is gone away. So, what we should infer from this?
okay.
Okay, you read and just comment
Okay.
next
For me,
time.
it's
No
a new
problem. Your
good.
understanding is better than us, definitely. So, you just
Yeah.
read and let us know next time. Okay.
Yes, surely. In a busy tertiary level unit, setting is a side room on the neonatal unit. You are talking to Mrs. Lewis, mother of 2-week-old Bernard. Background information: Bernard was born at 25 weeks gestation, weighing 700 grams. He is now 2 weeks old and remains ventilator dependent. Clinical assessment and subsequent echo scans show a large PDA. It has been planned to start Bernard on medical treatment with indomethacin. I think nowadays it's a proven. So you need to explain to Mrs. Lewis the treatment plan and the potential outcome following medical therapy, right? Okay, so Dr. Irfan, what would you like to be, role player or candidate? Oh, open your mic, Dr. Irfan, it's mute, I think. I think
I
Dr.
think
Irfan
30
Yes,
is
boss.
minutes.
busy, so maybe he's busy.
Yeah, yeah.
30 minutes of these meetings are done. Huh? If you want to rejoin, it's okay. No problem.
Okay, I think the 9 minutes we finish it, right?
Okay, no problem. Not an issue.
Hopefully.
Yes.
So Irfan, what you would be? Role player or
As you
candidate?
like, boss. As you like.
Up to you.
Up to you.
Okay, as you like. I have no issue.
Okay, then give us the task. You are the boss, no?
If you're interested to be,
No, no
okay,
issue.
then be already you had a role player, so now be a candidate. Okay.
Okay, no problem. Yes,
Okay,
good
I will be your
morning.
role player. You may start now.
Yes,
So name
yeah,
is 2 weeks old Bernard and Mrs. Good morning, doctor.
good morning. I'm Dr.
Good morning.
Yeah, I'm Dr. Irfan, one of the baby doctor, taking care of your baby. I believe you are a mother of Bernard.
Yes, doctor, I am.
So today we are here to discuss about the condition of the Bernard. So do you want anybody to join this discussion?
No, doctor, it's okay. My partner is busy right now, so it's okay. How is Bernard now?
Well, I will explain to you. I have made arrangement in this room. Nobody will disturb us, and I will explain you each and everything, and your answer. I will answer all the concern which you have. So,
Thank you, doctor.
yeah, you are most welcome. Anybody has give you any update about the Bernard?
Yes, doctor, they are telling that he's not responding. He's on the breathing machine, and I don't know what is going on, for how long he would be on the breathing machine. As you know, he came very early and very low. That is very small baby.
Yes, I appreciate your art concern, and uh, and as you know, he has been on the breathing machine for a long time than as usual, and we found that he has a duct that is still open
What
that
duct,
we
doctor?
call this duct is usually remain open when baby is in the womb, and it get closed when baby born, and this thing is more in the early born babies. We call it PDA. Have you heard about this thing?
When they put on the baby on the machine, so one doctor has told me about this, that he has a hole and it's normally usually closed.
Yes, I'm sorry to say it. he has this duct open, which making his breathing difficult, and we are not able to wean from the breathing machine.
So, doctor,
So
why this, as you said, it's usually closed after baby born, but why it has not been closed in Bernard case?
this is a very good question. As the Bernard born early, and this is very common thing in the early born babies. Okay, and it may close. There's a chances in the early born after some period of time, but in most of the babies, which we have like which are born very early, like 24, 25 weeks, they remain open.
Okay.
Yeah, and if I just draw a diagram, see, we have a two channel in our body. How can I draw, Dr. Pratap?
It is a screen already I shared. It's up to you how can you draw.
Yes.
There is a
Yeah,
pen on your side, right or left or
yeah,
right.
I yes, there is. Uh, so okay, anyway, just to consider I'm drawing this thing. I'm giving you showing
Okay.
the two channels. One is blue and one is pink blood. Usually they remain separated. Okay,
Okay.
and blue channel for sending blood to the lungs for the oxygen to mix, and the red
Okay.
channels for the blood supply to the other part of the body with oxygen.
Okay.
They usually are separated. When this duct is present, they get mixed. Eventually, the more blood towards the lungs, okay, making them stiff and tight and affect the function of the lungs. I'm clear to you so far.
Okay.
So this make
Mm,
the baby remain dependent on the breathing machine.
okay. Okay.
So in this scenario, we have difficulty to wean the patient from breathing machine. In this scenario, lung also becomes stiff and heart also work more than normal to pump the blood to the other part of the body. I'm clear
Mm-hmm.
so far?
Yes, doctor.
So yeah, this is the main problem. So we need to close this duct.
Okay. So you will do surgery, doctor?
Not this time. So you will start with the conservative measure, like we will give low fluids and we will give some medicine. Have you heard about endomethacin? Nowadays we are using brufen, ibuprofen. That is safe medicine than before.
Doctor, very small baby or very small baby, how can he tolerate this medication?
Yeah, it's a very good question. And we have this medicine has been tried, and we have success with this after giving this medication. Most of the duct get closed
6 minutes.
without.
6 minutes
Yeah,
first.
yes, yeah, yeah. This medication has a good effect. Most of the baby get close their duct with this medicine and safe. Anything
But
else you
doctor,
want
if
to?
you will keep Bernard on the breathing machine for a few more days, so maybe duct will close by itself. Why you want to take him off from the machine?
Well, I respect your opinion, but if we do like that, we will prolong the suffering of the Bernard. He will remain uh, ventilator dependent, and also it will affect the lungs. And there's a chances lung will get damaged. We will not get a required result after giving us further time for this duct to close.
So doctor, if you will give this medication, so is
Yeah,
there any like every medication has side effect? So what about the side effect and these things?
yeah, you are right. It's very valid question. We will monitor his progress. Usually, this medication, as we have been giving to the other patient, is very safe, very minimal side effect. So this is the
Okay, yes,
that's
okay,
why
that's good
after,
thing.
yeah,
Okay,
it's very,
if he not
yeah, yeah.
improved after this medication,
Yes, this is very valid concern, I must say. The next last resort is we have to take the help from the doctor of heart for surgical closure.
oh, I hope doctor
Yeah,
will not
I'm
reach
sorry
there.
to. I hope for the best. As I
Okay,
explained to you before, that we have been successfully treating this condition with this medication that is called ibuprofen, and we are getting very good result with
thank you,
minimal
doctor. Thank you very
complication.
much.
Yes. Anything else you want to know?
Thank you, doctor. Thanks a lot.
Yes, I will sum up my discussion in the points that we discussed, that the Bernard has a duct which is called PDA in short form, patent ductus arteriosus. So it needs to be closed with medicine, and it will be very chances that it get closed. If not, then we will take the help from the doctor of heart, and we can have another meeting for further discussion. And if you have any other concern which is not answered this time, we can have another meeting. I will provide you information leaflet.
No, okay,
And
time
for
is up,
this,
doctor.
yeah, thanks a lot, really. I appreciate your
Thank
patience and
you.
your active participation. Thanks a lot.
Thank you, doctor.
Yes, you are
Okay,
welcome.
so my feedback regarding your this communication scenario about PDA, it was very nice. You explained me in very slowly and gradually all the things. The thing you came on agenda at 4.5 minutes, 4.5
Wallahi,
minutes around.
actually, Doctor, I want to clear this
I
thing. I
was
don't know.
thinking why you are telling me what you want to tell me, why you want to discuss me. I came to know around 4 minutes and 30 seconds.
Okay.
Right?
This is my confusion, Dr.
Agenda
Lokar.
meet was very
Uh,
late.
hold, 1 minute. I'm confused in this. You are right. When we are doing introduction, like I'm Irfan, blah, 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 your mother, blah, blah, blah. So after that, I should say he has PDA.
If
Got my point?
see, you have to explain everything. Yes.
No,
He's on
my
the
point.
breathing machine. Why? Because he has a PDA.
Yeah. No. My question is that, suppose I told you that we are here today to discuss the condition of the Bernard, right?
Mm-hmm. Yes.
So I mean, yeah,
And
this is my
yes, you at that time
my
I get
question.
you. I get you. Yeah.
Yeah.
Yeah, I get you. So at that time, like for example, I'm Dr. Wakar, one of doctor, children
Yes.
doctor. After this, all this and repo and these things. So Mrs. Lewis, as you know, that Bernard has born very early, and he has a condition which of the heart, which he has born with, which is called the patent ductus arteriosus. So if
Okay.
you at that time, definitely mother will be shocked or this, then you if mother has some response, you should stop it. Okay. Then you
Okay.
have to explain what is PDA by the diagram.
Okay. Right.
Okay.
Dr. Wakar,
Then
you are
as you
right.
mentioned
Oh,
about. Mhm.
yeah, you are. My concern is that, suppose if I go like that, okay,
Mhm.
then how I will say, any update about this condition?
Yeah, it's like you explained it. Then you ask, do you have any idea or do you know anyone has told you about this condition?
Well, I really am confused in this scenario. You are right, but
Mhm.
I'm confused how to
Dr.
Right.
handle.
Dr.
Uh-huh.
Irfan, you can go directly, like first of all, you have introduced yourself, congrats or something what you want. After that,
Yeah.
you should ask that what are your understanding. If the mother is by herself, she is saying that she is having this doctor told me, open doctor, something like this, then it will be very easy for you to explain further what is this, then it's okay. If the mother is saying that he is on the breathing
No,
machine
you
and
are right.
don't know, I have only
Uh,
this idea,
my,
then you
my
can say,
concern is, you are right.